with a small group of 4 Mauritians from the diaspora. This is an initiative that we have launched about 2 weeks ago, and we've built a Crisis Diaspora Appeal Platform. And our aim is to engage and channel efforts towards this crisis response after the oil spill. We have no political affiliation, and our first initiative objective is to support and give visibility to several organizations in need, and particularly the non-governmental organization. We've created a fundraising campaign which has already reached over 25,000 euros since we launched on the 18th of, was it the 18th, a week before. We're very pleased about that, and we keep on working towards this fundraising that will go first to the Mauritian Wildlife Foundation. The second objective of our platform is to create a pool of expertise so that we can exchange and provide know-how and skills directly to the actors on the ground. So this sharing of experience with lessons learned and good practices that we want to put together. We've started with a webinar last week, and our webinar today will be focused on the long-term effects of the oil spill on health, public health, and including the psychosocial aspects oil spill may have on communities. And I must say, I'm truly honored because we are bringing together eminent experts from both the Mauritian and global community. We have practitioners, we have scholars, we have academics, captain of industries to discuss and exchange today. And so I would sincerely wish to thank you all for having responded to our calls and graciously offered your knowledge and insights with us on the platform. Joining us from South Africa is our moderator. We have Dr. Soriyamati. He is a Mauritian. He is a general practitioner at the Montagu Hospital in Western Cape, and he works both on chronic disease and emergency. Dr. Soriyamati will be presenting our panelists, and I will let him take over right after I will give him the floor. So welcome, Dr. Soriyamati. Also, allow me to remind some casual etiquette rules for everyone. Mics will be muted, and only the speakers will be heard. We will have a Q&A session at the end of the presentation. So if you want to ask anything related to the discussion, please send them via the chat option. No questions will be taken live. My co-host, allow me to introduce my co-host is Dr. Smita Gura. She is an associate professor at the University of Mauritius. We wanted to have this representation today to show the importance of research with regards to that long-term path to recovery. Oil spill, luckily, but unfortunately, is something very bridge that gap, and that's a lot.
And it's fantastic to be joining you all.
As a medical practitioner herself in the UK, and then joined academia sometimes back. She is a member of the Clinical Research Regulatory Council as well. So without further ado, please, I give you the floor, Dr. Gura.
Hi, hello everyone. Thank you, Adish. It's fantastic to be joining you all. I see that you're all from different parts of the world. So I am actually a Mauritian living in Mauritius. And I just first of all want to thank Adish and his team for organizing all this. This is a great initiative. So a few words about myself. I have studied medicine at Queen's University of Belfast, and I have done my specialist training in the United Kingdom. And since 2002, I have joined the University of Mauritius as a lecturer, and I am now an associate professor with an interest in the health impact of environmental hazards. So unfortunately, with the oil spill, which we did not expect, this is giving us an opportunity to study the health impact of such unfortunate events. And we're watching this very carefully. There has been a lot of work done by authorities and by volunteers, by NGOs, by communities, and they have done a fantastic work in minimizing the effects of the oil spill. It has been very difficult for everyone concerned directly, and we have seen a lot of impacts already on marine life. But one of the main research questions is what will be the impact on human health? It's not so obvious. It can be a very insidious impact. There are many concerns from our local communities, our fishermen, our people living and working in this environment. There's also an impact, a larger impact on Mauritius as well, a psychosocial impact, because as we have mentioned several times, this is the first time that we are facing such a problem. So research-wise, we will need to be looking at the long-term impact of the oil spill on human health, the routes of entry of pollutants, whether it's going to be airborne, what will be the most important route, airborne or contact or by ingestion, what will be the doses, the concentrations of pollutants in our waters, how can we minimize these effects on human health, and how long will we be, for instance, how long will we be monitoring people? How many people will we be monitoring? What will be sort of the effects on the next generation? Will there be any effects on women, on reproductive health, on children, on the pediatric population? So these are some of the questions that we are asking ourselves, and I think the community as well is asking these questions. And there's a lot of reflection going on. So I look forward to some interesting discussions. And again, I thank you all for inviting me today to participate in this. So over to you, Adish.
Thank you, Dr. Gora. Now allow me to introduce Send and Dr. Soriyamati. Thank you.
Thank you, Adish. I hope you can all hear me. Can you all hear me? Yes, good. Thank you so much, Adish. Thank you, Dr. Gura, and thank you for being the hosts of this event. I hope I say thank you here for the introduction, and most importantly, thank you to the Mauritian diaspora for creating this fantastic platform for discussion. My name is Dr. Soriyamati. I am indeed a fellow Mauritian, and I'm born and raised in Mauritius. I left the island when I was just 18 years old to study medicine in South Africa, where I have now been practicing as a GP for the last few years. I have experience in primary care and emergency care, and going forward, I have particular interests in internal medicine. I must say, as a young medical professional, I feel extremely privileged to be part of this initiative. Thank you again so much for inviting me to moderate this session. It is with great pleasure that I am here to learn and hear this exchange happening tonight. Allow me then to formally extend a welcome to everyone joining us tonight for this second episode of the webinar series on the Wakashio oil spill in Mauritius. I must say, like all Mauritians around the world, it has been absolutely heartbreaking watching the oil spill in what looks like the worst possible location on the island. Just to quickly bring everyone up to speed, and for those of you who don't know what we're talking about here, on the 25th of July of this year, a bulk carrier named Wakashio ran aground on the southeastern reefs of Mauritius, spilling over 1,000 tons of heavy fuel oil in the protected lagoons of Mauritius. This is what brings us here tonight for this discussion. And I believe as scientists, and in particular those of us working in the health sector, it is our role to act as guardians for human health, and our duty is to look after the population and ensure their health and safety. It is therefore our responsibility to have discussions around this topic, and not only to identify problems, but also to develop a focused approach to finding solutions. Like Dr. Gura said, a lot of questions have been raised among the Mauritian population, and it is so important that we have a discussion around this topic. As Adish mentioned, tonight's webinar will be therefore addressing the short and long-term health impacts of the Wakashio Oil Spill in Mauritius. And we are so honored to be joined tonight by eminent expert contributors from all over the world, namely the UK, the USA, and Reunion Islands. And I'm sure they have a lot of experience in the field and will benefit a lot from the interaction. And undeniably, human health is complex, and we need a lot of input from various fields as we will approach this from a biopsychosocial model, not only addressing the physical health impacts, but also the psychological and socioeconomic impacts. And diving right into the discussion, we will now welcome our first speaker from the UK, Dr. Richard HERON. Dr. HERON is the Vice President of Health and Chief Medical Officer at BP. He is responsible for strategic development of BP's health agenda, including employee well-being and occupational health and hygiene, and community and public health in the locations where BP operates. He trained in internal medicine before specializing in occupational medicine. And of note, he is a fellow of the Royal College of Physicians, the UK Faculty of Occupational Medicine, and the American College of Occupational and Environmental Medicine. Dr. HERON also holds honorary appointments as Professor of International Business and Health at Nottingham University, and is an honorary teacher at the University of Manchester in the UK. So with his extensive background in the occupational health, and specifically with his experience working in the BP spill in the Gulf of Mexico in 2010, Dr. HERON will be addressing the occupational health concerns and the key economic sectors impacted by the oil spill. Dr. HERON, thank you so much for being with us tonight. I will now let you take the floor.
Well, thank you, everybody. And first of all, let me extend my my sadness for the spill that you're experiencing. And it causes me to really reflect on my own experience back in 2010. And a number of us on the call actually remember that very, very well. What is really a tragic and sad event is the first thing to not forget in terms of impact on people. I just thought really it would be helpful to share almost my personal experience. I'm a physician at the core, but clearly I'm working for an international energy company. And in that respect, I will always be conflicted in the conversations that I have and in how they're perceived. So that's really just to declare an obvious potential conflict of interest. But I think what I can share is how this felt, and it is almost always feels unprecedented, like it's never happened before to the individuals involved, even though it may have happened before. In 2010, my principal concern was with the responders who were involved in cleaning up, either those who are working for the company or were hired by the company and that sort of thing. And if you can imagine that in a period of about 10 weeks, that number went from pretty well 0 to 48,000, you know, and you're suddenly in a almost overwhelming military operation. It just feels enormous, just enormous. And in that situation, there were about 6,500 vessels that were involved. The situation involved 2,500 miles of coastline. and multiple states and different jurisdictions. So that was what one was faced with in an immediate situation. And I think when one had to think of things in short term and middle and long term, in as much as how we sort of looked at that. In the short term, it really was around trying to understand some of the risks, trying to understand some of the significant issues that were very, very immediate. Potential hazards at that time, particularly that we experienced, were heat. We had very high temperatures in that region at the time. So thinking about the effects of heat on workers was going to be critical. And also looking at what capabilities were going to be needed to assess the risks to anybody involved in that response. And what I think I learned very quickly was you need to develop a very multidisciplinary approach, multi-jurisdiction, multi-regulatory group approach to almost everything involving, because you're in that situation, you had a unified area command structure for dealing with events offshore that was already in place. But you had OSHA, the Safety and Health Administration, you had FDA administration even looking at food issues, you had environmental agencies, you had Coast Guard, and each one was working in their ways to determine what the risks were and how they would be managed. And NIOSH and others and CDC were involved in this, Health and Human Services, multiple jurisdictions. So I think quite quickly trying to get to a place where you're all trying to work with the same language and understand the risks together, and where possible, I think, get a shared view of what those risks are and how best they could be managed. Because there's not always one view and there's not always a shared view, but if you can get to a shared view as quickly as possible, this is very, very helpful. So I think that was one of the biggest pieces of learning that I picked up during this whole event. I think the second thing really was just to go right to the core of what you're talking about, is about long-term effects. And very early on, within a few weeks of the spill happening in April of that year, I went to speak to the National Academies of Science, the president of the National Academies of Science in the US, and asked that the most independent, most revered scientists of relevance should be involved in independently determining the scientific evaluation of harm and effects in future. Whatever I would say would be regarded as being partisan, no matter what my personal views might be, because I'm paid by a company, therefore everybody will say, oh yes, well, you would say this. So I both had to acknowledge that, but also to overcome it, I think, as well. So I went to many public meetings. I made myself available. To be honest, it was quite scary at times, because there were quite naturally many people who were very, very angry and very upset, and reasonably upset with companies and things. I still felt I had something to offer to help with some of this. So actually to get over that was a big deal. I think the other piece of learning that I pulled from this, and again, I'll stop shortly so that others can share their perspectives, is the importance of community-based participatory research. Everybody has an agenda. Everybody has an agenda. But you know, no matter wherever we come from, we have something that is driving our perspective. But I think some of the best understanding comes when it is the questions of the community are at the heart of the science, number one, and number two, that they are involved from end to end. This was something I really learned throughout this whole sad event, really, that it's not good enough to have great scientists working out the answers to difficult questions and then find somebody to communicate the answers to people cold. Actually, you need to work with the communities directly. What is on their mind? What is worrying them? Number one. Then they need to be involved in the design, actually, of the studies. They really need to be happy, and I say happy, they need to be content that they are integrally involved in the design of how the question will be answered. I think actually it helps for them to be involved in even in the sampling and testing and toxicology and anything to do with this. They need help to be involved in these things, but actually I think really end to end, and community leaders are also best placed to articulate outcomes of research to those that they most closely represent. And I think some of the, when I look at what didn't work perhaps in some previous issues and previous incidents, not just in oil, but in major incidents, it's where this hasn't been considered in that level of depth, People have gone into these difficult questions, the desire to understand the harms, to protect and to do the right thing, but they've done it from an intellectual perspective more than from a, a representative approach. I'm in there with you, an empathetic approach. And I think that means that the results are always difficult to accept one way or another. Either if there is nothing to find or if there is something to find, it's actually about the whole end-to-end process being highly trusted by the people who each of you represent. Now, to be honest, I could talk all day about this, and as many of you know, I have had to do this in the past. But what I would say is involving specialists that may not be locally available throughout this was also helpful. Industrial hygienists who can do testing of atmosphere and monitoring of breathing zones and of routes of exposure. It's not a skill set or a capability that is universally available worldwide. And it's also difficult to scale up. We had over 400 health professionals involved in this spill. 200 of them were industrial hygienists looking at exposure and also engineering controls. Paramedics, over 175 paramedics, because when you're looking at people who are helping, they come with a variety of health backgrounds of their own. So some people who want to help are not necessarily so fit as other people. They need medicines, they need their prescriptions, they need other things to be filled during a response as well. So don't forget about the general health issues associated with people who are working on a response. And I think lastly, a lot of people are very, very committed, and we will wear ourselves out trying to be heroic. So sometimes we need help to stand back, to manage fatigue, to take rests, to turn over people so that you have some people taking a rest, some people coming back. I'm thinking really about some of the very basic human needs because sometimes these things go on for quite a long time before they're solved, even in the short term, in the cleanup, let alone the long term effects. So I think those were probably some of the biggest lessons I learned. And what I would say is it's probably less helpful that I comment on any of the research, because whatever I say is to be disregarded. But what I would say is look at the research. There is a lot of good research out there, but look at it in detail and with a critical eye about the design of the study, the epidemiology, the statistical validity, and actually one has to look in great detail, right down to selection processes and how people are involved and what a study really shows. Because as I said, whether it's for one side or another, there will always be a view. And as he said, there are lies, damn lies and statistics, and somebody can use them to show whatever they want. So I think, just go in with that inquiring mind and that empathic heart of all of those who may be affected. Back to you.
Thank you, Dr. Thank you, Dr. HERON. Thank you so much for your input. I think you addressed a lot of important aspects of the response that we need, and it's a great way to kickstart this discussion. Now, when it comes to oil spills, our next guest speaker has experienced it personally. Indeed, we now welcome Dr. RIKI Ott, who is recognized internationally for her activism and leadership in oil spill disasters. And Dr. Ott holds a PhD in sedimentary toxicology. She is a marine toxicologist and former Alaska commercial fisherman who experienced in the 1989 the Exxon Valdez oil spill firsthand. She wrote several books on its impacts on people, communities, and wildlife. She was frequently introduced and consulted as an oil spill expert in the 2010 Deepwater Horizon oil spill. She has worked in frontline communities, those at risk from oil and gas activities. She shares a science-based training on oil chemical exposures and illnesses, as well as oil spill preparation and response. Dr. Ott, we are so honored by your presence on our panel tonight. You often speak about the dose plus host making the poison. Given your experience working with oil spills and how they impact communities, what should we be worried about, and what can you advise us going forward into the discussion?
Okay, thank you very much, Adish, and thank you, Lalini, and everybody for this opportunity to share what I know, and hopefully it will assist your recovery efforts. So we actually learned during the Exxon Valdez oil disaster two major paradigm shifts. One was in the field of oil ecotoxicology, in other words, oil spill effects on people and wildlife. And basically that was oil is 1,000 times more toxic than we thought. The second one, which I'm only going to address very briefly, was that natural disasters and man-made disasters are completely two different beasts when you're talking about mental health harm and trauma recovery. And I'm just going to crack open that door for everybody at the end of the toxicology section. So what we learned specifically during the Exxon Valdez was that the scientists pre-Exxon Valdez had focused on something called volatile organic compounds. Those are that's the fraction of oil that dissolves very quickly into the air or evaporates into the air, dissolves into the water column very quickly. There was a lot of laws set on that, a lot of safety standards. And if you think about what that looks like, benzene is probably the simplest compound. It looks like a honeycomb, one single honeycomb hive in a bee. It's a six-sided little ring structure. And it turns out that really is a very short-term problem. Benzene is one of the oldest known carcinogens. Yes, that's true. However, it's actually the black stuff that's left on the beaches, on the bottom of the water column, that are very hard to degrade, that actually cause significant long-term damages. And if you start taking that little simple benzene ring now and start hooking it together and think of maybe like the Olympic rings, you have these, 2, 3, 5 and more structures, and it was the 3 to 5 ring polycyclic aromatic hydrocarbons that cause this damage. And I'm specifically talking about things like behavioral problems, genetic mutations, diseases, death, cancers, physical deformities, and a lot of physiological malfunctions, respiratory damage, central nervous system damage, reproductive problems. These are endocrine disruptors. They jam hormone function. That's the bottom line in organisms and in their offspring. So this damage can be passed on to offsprings, including human. So the focus after the Exxon Valdez really has shifted to polycyclic aromatic hydrocarbons. And the other thing that hasn't consistently shifted yet is that through the Exxon Valdez even through the BP disaster in 2010, the focus is really oil on the water, oil on the water. What do we do to minimize harm from the oil on the water? Well, it turns out the oil on the water is not just staying on the water. It's going up into the air, even the PAHs from the wind action, the wave action. It's going down in the column where it's being bound with bacteria and sediment and forming these oily plumes like were found during the BP disaster that slowly sink down to the bottom. And then you have this massive oil that was on the water suddenly down on the bottom of the ocean. And these PAH rings are very difficult to degrade. They're called heavier oil fractions. And what spilled with the Wakashio is heavy fuel oil, which is concentrated in these PAHs. So you're dealing with a very concentrated amount, fraction of these PAHs, which also photooxidize. So the degrade and these agents that are formed, it's called phototoxicity, where the interreaction of UV light actually creates an intermediary compound that is very dangerous very toxic to people and wildlife. So unfortunately, with all this danger, the body only has so many ways to show a person that you're in danger. And the acute symptoms now, which are recognized as being characteristic of oil spill exposure, and this paper, the first paper came out on this in 2011, which means it was in production in 2010. But at any rate, the common symptoms are common, okay? They're cold and flu-like symptoms. You look like you have maybe a bad flu, or your asthma is getting worse. Bronchitis, a really bad case of it. Bad headaches, a little bit of dizziness, memory fog, you're having trouble, concentrating. Sometimes blurred vision, sometimes tingling of the appendages, definitely ear and nose bleeds, especially in children, bleeding hemorrhoids, skin rashes and lesions, and you're maybe sick or tired all the time. Unfortunately, our body only has so many ways of saying you're in danger. And it's up to a doctor, healthcare professional, to decide whether you were just exposed to a food allergy, maybe you just painted your home, maybe you had bad pollen allergy, maybe you did catch a virus or a bacterial infection, or maybe it is oil chemical exposures. And the thing here is, it first sort of dawned on me that 13 years after the Exxon Valdez oil spill, that people who were sick during that then were still sick. So I started a sort of very informal phone interview calling people. And one person told me that, I thought I had the Valdez crud in 1989. I didn't think I would have it for 13 years. So the point is, don't wait 18 years, okay? Colds and flu should clear up in a week or two, not be dragging on for months and months. And the other thing here is that you need, unfortunately, this is still a very specialty field. Occupational medicine expanded in, I think, the 1980s to include environmental medicine, which means people exposed to pollutants, industrial pollutants in the environment, at a much lower level possibly than workers are being exposed, but over longer periods of time as these chemicals persist in the environment. So same chemical, maybe different lengths of time, occupational and environmental medicine was born. The key take home here from this part is that you can't treat a chemical illness with an antibiotic. It doesn't work. And I personally have a very different point of view, perhaps, from the first speaker, in that the entire first year of the BP disaster, and for I stayed in the Gulf Coast communities, in people's homes. I saw their children getting sick. I saw grandchildren who had had 8 rounds of antibiotics and the doctors were going to prescribe more. I mean, I saw things that should not have happened. There were no OEM doctors. There was no really treatment that I saw for what people were really experiencing, chemical illnesses caused by the oil spill exposures. So you can't treat a chemical illness with antibiotics. You have to detox. That's a whole nother field that I'm not going to go into. But anyway, I want to talk about dose plus host makes the poison, because sometimes, you have a family and you take your little kids to the beach, and I want to imagine a rain barrel right now, that their body is like a rain barrel, okay? And over time, drip, 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 your body is slowly filling up with toxins, industrial chemicals that are in the environment. You're breathing them in the air, you might be eating them in the food, you may be getting them in your water supply, you may be getting them from workplace exposures or home exposures, and your rain barrel is slowly filling up. Well, doing an oil disaster, you get a lot of exposures at once and you overflow, and that's when you get symptomatic. So there are people who are most at risk. They're more vulnerable to these oil spill exposures. And you might be able to imagine who they would be. Workers are an obvious one because they're on the front line. They're right on the front line of defense. Children might not be so obvious, but if you think of cold medication, there's cold medication for adults and there's cold medication for children. That's not the same dose. Children have a lower dose. So think of children, they're very active. They're breathing more breaths per minute than adults. They're breathing closer to the ground. These PAHs settle lower. They inhale greater concentrations of the heavier PAHs. And they have a larger skin to body ratio. So they're actually may absorb more toxins through the skin as well. So, so children are vulnerable. You might not think of pregnant women, but the baby in the womb has absolutely no defenses against these chemical exposures that the mother is getting, and the mother's super taxed because her body is trying to produce this new baby. Plus, deal with the oil chemical exposure. There's a lot of energy required in the enzymes to break these things down that aren't happening. So, and then finally, elders, because their rain barrel might be already full from a lifetime of exposures and suddenly more. And people with pre-existing diseases are also very vulnerable. So there's your dose plus host makes the poison. Not everybody's going to react the same. So you have people, you have exposure. How do you know if there are dangerous chemicals, number one, in the air, and the exposures are at dangerous levels? Those are two things that should be monitored in the air quality, because that's a ubiquitous experience for everybody. Everybody's got to breathe the air, okay? So once you get that, you may or may not have people in it long enough to be exposed to dangerous levels, long enough to cause harm. This is where I recommended during the BP disaster that people take a volatile solvent organic whole blood profile, and actually the levels in people's bodies were 95% off the chart for oil in the blood. So there was the connector to show that these exposures were causing levels that could cause harm in the body. Now, after intake, so you have exposure, you have intake, then you potentially may have harm if people are not treated properly. And at this point, the intake would come from inhalation, skin contact, possibly food, and so ingestion, and drinking contaminated water, possibly. So inhalation would be the one of most concern, I believe, and ingestion through the food. Now, how do you figure out if there's harm? You have to
Vicky,
look for. Yes.
Sorry to interrupt. You'll have one more minute just so that we can keep track
This
of time.
does
Sorry.
happen.
All right,
Right.
carry on.
I will sum it up. With biomarkers, now this research has been done, long-term research has been done by Spain after the Prestige oil disaster and by South Korea after the Habai Spirit oil disaster. So we found biomarkers which indicate the presence of a disease state. They have measured genotoxicity, which is damages to genetic material in a cell. And they have also measured the long-term outcome of this, which is oncogenesis or cancer formations. And this is long, there's multiple cancers. So I have submitted a PowerPoint with things to look up for more information on this. I do want to get, and this has also been identified now for the first time in the United States by the BP disaster. So we're about a decade behind in the types of research that Spain and South Korea have carried out. And I do want to mention that use of personal protection does reduce harm. To crack the door on natural disaster, on the mental health aspect of it, the difference between natural and man-made disasters are basically that in a natural disaster, you can't sue God. So there is a natural tendency for the community to come together and work to put out the fire, to help people, rescue people from the flood, to do whatever it takes to help each other. And that builds what's called a collaborative community in the sociology world. It's people working together for the common good. In a man-made disaster, unfortunately, there's finger pointing, there's people to sue. So not everybody can have a claim, and it ends up being extraordinarily stressful. You don't know when your fisheries are going to come back. You don't know if there's an invisible poison in the air that could kill you or your kid. There's a lot of unknowns, and unfortunately what happens is that builds a lot of pressure inside individual trauma that manifests as increases in divorces, suicides, domestic violence, substance abuse. And your community basically implodes from the inside. Please try to avoid that. And the trauma is healed through building social fabric by people working together for the common good. So I'll get to so that leads me to the recommendations. And I think I'm just going to start with the first one, which is be proactive. And one of the things that's very easy to do is a weekly or daily column on mental health effects, on physical health effects. This is what you can look out for. Are you getting headaches, dizziness, all that stuff? Are you feeling, stressed? Take that route. Show people that there's somebody listening. The other thing is starting up a citizens advisory council, which really helps. And I know other speakers are going to be talking about that. It can help with the mental health aspects. You need a dedicated team of citizens helping each other through this trauma. And another recommendation is to have the workers wear protective gear, which I'm delighted to see that you're doing. We could not manage this in the United States, believe it or not, okay? We tried. Measure the ambient airborne levels of benzene and the particulate matter at 2.5 emission. Don't rely on the spiller or any industry source to collect your data. Treat people with occupational environmental medicine. And that's it. Thank you very much. Back to you, Adish.
Thank you very much, Dr. Ott, for your experience and sharing it with us regarding oil spills. I think it is clear that acute physical impacts are obvious when it comes to an oil spill. And to understand that the effects of the long-term exposures of such chemicals, we are now privileged to welcome yet another eminent contributor, an expert who is in fact also a fellow Mauritian like myself, Professor Phan Chung. Now, Professor Chung is a professor of respiratory medicine, leading the experimental studies unit at the National Heart and Lung Institute, Imperial College London. He is a consultant physician at the Royal Brompton and Harefield NHS Trust in London, authority on the treatment of chronic obstructive lung disease, and has headed a group of international experts on guidelines for treating severe asthma. His current interests are, among many others, focused on the impact of environmental pollution specifically and nanoparticles on the lungs. Professor Chung, we are so fortunate to have you on our panel tonight. A warm welcome to you. I doubt we could find a more qualified person to weigh in on the respiratory impacts of an oil spill. What are some pearls of wisdom that you can share with us?
Thank you very much. Could I have a slide? I sent some slides through that could be projected. I'm very pleased to talk at this in this webinar, and thank you very much for the invitation. I must say from the start that I'm not a specialist of oil spills, and it's really an honor to be surrounded by many of you tonight or this evening. As you've heard, I'm basically a respiratory expert, but and the reason why I agreed to participate is because of my background in studying environmental pollution, particularly air pollution, and in London and in many other cities, the main source of pollution is from cars burning oil or combusting oil. But in this case, we're talking about crude oil, and you've already heard about some of the constituents of crude oil, and in fact, looking at those constituents, I mean, some of them are in fact what we sometimes see in air pollutants that comes from combustion of diesel or petrol. I must say that I have an interest here. I was born and grew up in Mauritius, and in fact, I grew up in this part of southeast Mauritius, so I do know that coast extremely well, and it really breaks my heart to see this happening, particularly that this happened on the shoreline, on the coast, and for many days this wreck was the object of of a lot of people coming to see it, because you could see it from the shore, and it really is a big disaster, because the oil just was poured onto the delicate flora and fauna of that area, and I hear that this spill now is over more than 10 miles, and in fact probably even more 30 miles up the coast. But I hope that the damage is not going to be as extensive, perhaps. And well, let's hope for the best. So so this big help that the population had by volunteering to clear the mess as much as possible initially, meant that a lot of people, and this has been typical of other spills too, of people that have been exposed clearly and without wearing any protective gear in helping to try and correct the situation. So one might expect that those people would have been very highly exposed to high levels of those constituent of crude oil. And you can see that, as has been mentioned, I mean, the route of exposure would mainly be through inhalation. Of course, there will be contact to the skin and ingestion, ingestion of course. And it's the inhalation route where I have particular expertise, and you've heard that there is inhalation of the volatile gases, but also through aerosol particles. And in fact, aerosol particles is a very important component of currently of air pollution, because of the particles that are being produced by petrol engines and diesel engines. But in this case here, those particles, I mean, we're talking about 2.5 micron particles at PM 2.5, but there might also be very fine particles, finer than PM 2.5, that are quite dangerous, because when you inhale those, they go directly deep into the lungs, and they get absorbed into the circulation and they go around the body. So we've talked about acute symptoms, and I won't go into this, and I think I will probably just mention the fact that there has been data showing that in acute exposure to this, there are hematological abnormalities, you've heard, and liver abnormalities, no doubt caused by damage by a lot of those hydrocarbons that are being absorbed by inhalation. But what I want to really focus on the more chronic effects, and I want to just illustrate this with one slide, which is on the next slide, which is, I think, is probably the best study that that's been done so far, and this is the follow-up of the European oil spill off the coast of Portugal. Of Spain, in Galicia, and this is the it's an extremely advanced study. There's a control group, and then there's a group of people who went and helped. These were mainly fishermen who went and helped to clear the mess in the first few weeks following the event. And I just want to show there table 2, and what's in the red circle is that after 4 years, there was an important prevalence of people who had those symptoms of related to the chest, most of them, wheezing, as you see, shortness of breath, chronic cough, and producing phlegm. So they have a productive cough, and they have nasal symptoms, and you got also diagnosis of asthma in 5%, and in 5% there was chronic bronchitis, and in 8% there was some form of rhinitis or nasal allergy. So there is, 4 years later, and this was confirmed in the next survey, which was 5 years or a year later, which confirmed that, and also in that study, which I'm not showing, is that they confirmed also that there were changes occurring in the blood. There were certain biomarkers that were increased, and these were the biomarkers that would reflect this condition of oxidative stress, which is also, which we also see in people exposed to current air pollution. So I think there's no doubt that there are long-term consequences of being exposed initially. So, and you can see here that the risk of developing those respiratory symptoms really is increased by, I can't see this bit of the slide, increased by the amount and the length of exposure initially. So the next slide, I think, has already been referred to by Dr. HERON, and I'd just like to finish on the next slide, because this is the US Institute of Medicine initiative, which was derived from a meeting of experts that met after the Gulf of Mexico oil spill. It was a huge spill, and to discuss, what should be done in terms of looking at the health effects. And I just want to list those initiatives that came about this, and this was mentioned by Dr. HERON, and so, developing protocols for clinical evaluation of people that have been exposed, those people who've been working initially with trying to clear the mess, banking biospecimens, blood and urine, short and long-term medical surveillance, and of course psychosocial intervention, which has already been mentioned, and also treat those particular groups that may be more susceptible, those with pre-existing conditions. And I think those conditions that are mentioned there are in fact quite prevalent in Mauritius, and that's why I mentioned them. So this is what I would suggest, particularly from the respiratory point of view, but of course, this exposure is not going to just limit to respiratory condition. They might affect cardiovascular system. They might be predisposing to cancer, and we don't know. In fact, we have very little information about this because I don't think there's been enough follow-up on that, and other effects, and you've heard about potential effects on pregnant women and on babies.
Thank you, Professor Chung. Thank you very much. I think it gives us a lot of reading to go and do, and really go and look for specific things in terms of what we need to look for in patients, especially specifically what you mentioned about biomarkers, which is really important going forward. And as you mentioned, this talk tonight is not only about mentioning the physical aspects or physical health impact, but also considering the associated psychological and social trauma that comes with an oil spill. Joining us tonight to talk about this is Dr. LIESEL RITCHIE, who is a professor of sociology and affiliate of the Center for Coastal Studies in Virginia Tech in the US. And during her career, Dr. RITCHIE has studied a range of disaster events, including the Exxon Valdez and Deepwater Horizon oil spills, the Tennessee Valley Authority coal ash release, Hurricane Katrina, and earthquakes in Haiti and New Zealand. So Dr. RITCHIE, welcome to this webinar series. Your experience studying community resilience in such disasters is so valuable to us here. What are we looking at in terms of the psychosocial and impacts on the Mauritian people? We would really like to hear that.
Great. Thank you so much for having me. Good afternoon, good morning, good evening, depending on where you are on this call. It's a real honor to be in a position to share what me and my colleagues have learned during the past 30 years of research. I will say from the get-go that my work builds on the early work of Dr. Steve Piku and Dr. Dwayne Gill, who started studying the Exxon Valdez oil spill from a sociological perspective initially when it began. They were in the field very quickly and started to collect data, not only from the communities that were most directly affected, but by controlled communities, which Richard HERON was speaking about, and the importance of these, the very research that we're talking about today across all fields. I am a disaster sociologist, as was just mentioned. The majority of my work is funded by the National Science Foundation, and most specifically, I look at psychosocial impacts of technological or human-caused disasters, and I'm also focusing at this point in my career on community resilience. Lalini, would you mind to put up that first slide? Thank you for that. Some of the things that I'm going to talk about are similar to what Ricky Ott spoke about. I want to sort of warn you that some of the things that we're talking about are very difficult. If you could go back a couple of slides, that would be helpful. Okay, so my title is really important to me because we know so much about the social science effects of community impacts of marine oil spills in particular. And I'm calling this hope through awareness because even though these things are really challenging, there have been some interventions following oil spills and in preparedness activities that Mauritians can look to and help them to understand what might be going on in their communities. So we've been talking about psychosocial impacts, and you could go ahead one slide, please. So what is psychosocial stress? So psychosocial stress has to do with the interrelationship between social factors and individual thought and behavior. So it's a combination of psychological stress and social stress. And this is where we get this interaction that can be so socially disruptive. Next slide, please. I'm going to leave this here. I've had the unfortunate opportunity as have others on this webinar, to study a number of communities impacted by oil spills, ranging from those affected by the long-term impacts of the Exxon Valdez oil spill to the impacts of the BP Deepwater Horizon oil spill. I've studied a couple of smaller ones, and interestingly enough, although every spill has its own unique environmental and very community-specific impacts, there are a number of cross-cutting social dimensions to oil spills that we know about because we've studied them. There are, of course, cultural considerations, and I think that's going to be very important to keep in mind as you all move forward. And I think another thing that hasn't been mentioned to date on this webinar is the fact that we're dealing with a global pandemic that is also affecting what's going on in this situation. So we have not only the oil spill to deal with, but the social and psychological impacts of COVID-19 with which we're dealing. So let's keep that in mind as we're talking about some of the potential impacts and some of the potential activities as we move forward. So it's very difficult for those who've not experienced an environmental disaster to fully understand what communities that have gone through. And again, a number of folks on this webinar have been in communities directly following oil spills or even before oil spills and witnessed the change over time. And these are the people that I think we really, really need to listen to. And again, let me say, I think there's some hope through this awareness of the things that I'm about to share with you. So research has shown that renewable resource communities are especially susceptible to the adverse impacts of toxic contamination like oil spills because they depend upon renewable natural resources for their social, cultural, and economic resistance. As I understand it, parts of Mauritius are renewable resource communities with reliance particularly on fishing and community tourism. Although stress might not be community-wide either in this particular location or in other locations, certain groups, such as those I mentioned, commercial fishermen, subsistence fishermen, as well as those who rely on tourism, are more likely to experience stress and to be vulnerable to other adverse behaviors. In spills that we've studied to date, we found overall pervasive uncertainty in affected community, and this uncertainty generates stress. And some of what we're talking about on today's webinar is a perfect example of uncertainty and the effects not only on the environment, but what the effects might be on the social environment as well as the physical environment. So this uncertainty stems in part from what we would call contested interpretations of the event. And again, you can see this even in some of our conversations already, that there are different interpretations of what's going on. We need to think about this shared view and how to come to this shared view. How much oil has been spilled, for example, is a question that's going to be asked. What will be the short and the long-term effects of the oil on the natural environment? Similarly, what will be the short and the long-term psychosocial impacts on these communities that have been affected? What cleanup approaches are most effective and the most safe? And what responses in terms of policy and government and NGOs are effective and most appropriate for this particular situation? So we find that typically government agencies are saying one thing, responsible parties are saying another thing, and those with local knowledge, which is incredibly important, have different interpretations of what's going on and the extent of the damage and the possible damage that this spill might cause. So just as environmental impacts are sometimes unclear, what might be referred to as invisible trauma, as we found in the literature from a sociological perspective, are that social environments are also affected. Community ties to the environment tend to dictate the amount and the nature of what we would refer to as social disruption associated with oil spills. As Ricky mentioned earlier, there can be a good bit of disruption to the social fabric, and we refer to this as a corrosive community. Within the local community, there can be tension, even conflict between groups that believe that the adverse impacts of oil spills or other forms of toxic contamination are significant, and those who have less concerns. And this can also be said for groups that are within a community and groups that are external to a community. Secondary trauma from bureaucratic processes, including compensation efforts, can cause stress. So let's keep in mind that it's not just the oil spill itself, but processes that are sometimes designed to ameliorate those impacts through financial compensation, for example, can cause stress as well. So what do we know from psychosocial impacts of marine oil spills and the research on that? We see heightened levels of stress and depression, harmful mental health impacts and behavioral impacts, as well as social disruption. And there are also strong relationships between elevated levels of anxiety, stress, and depression, and concerns about spill-related economic impacts, as have already been discussed. Individuals with high level of community attachment, so people who are very tied not only to the physical environment, but the natural environment and to their social fabric, experience increased stress, as well as apprehension about community well-being. And what we know are the strongest predictors of who will experience stress include concerns about family health and economic futures of those families, economic loss from an immediate standpoint, connections, as I've mentioned, to renewable natural resources, the extent of exposure to oil, including through involvement with cleanup activities, and involvement with, as I mentioned just a few minutes ago, with compensation processes. And again, what we find that these spills are not just consistent in terms of the larger spills that we're seeing in the large scale, but the smaller ones as this one might be considered. So again, these effects are not just short-term, they are long-term. These potential impacts are of concern, but there is some hope. I believe that probably Rick Steiner is going to talk about some of these activities that can be undertaken post-spill, so I won't step on those toes. Recognizing though and understanding the potential adverse mental health impacts and community level social disruption is very key to addressing them and getting ahead of them. Next slide, please. I won't go into detail about this, but I'll make it available through the group here. This is what's referred to as the constellation of potential human impacts of marine oil spills. And this was developed based on a National Academies of Sciences workshop. What we see here are psychological effects, physical health effects, economic and sociological effects, as well as cultural effects, which again, I think need to be taken into very careful consideration with Mauritius. I won't go into any more detail, but the last slide, please. Here's a link to a Coping with Technological Disasters guidebook that was initially developed following the Exxon Valdez oil spill, and has subsequently been adapted to Hurricane Katrina, as well as the BP Deepwater Horizon oil spill. And I hope that you will be able to take a look at that. I will again leave this in the hands of the organizers to share. And if you have any questions, please feel free to contact me directly at my email address that's listed below. Thank you for your time.
Thank you for making yourself available, and thank you for the resources you shared, Dr. Ritchie. I think you mentioned, you raised very important points, especially regarding the invisible trauma that comes with an oil spill. And especially, like you said, in the context of this pandemic, the COVID-19 pandemic, we're forgetting to mention that, because that also has an added effect and an added burden on people. And I think when we're thinking about our recovery plan, it's important that we start moving forward with decisions. And when we talk about decisions, we need to start involving communities into the discussions surrounding plans that need to be made. And I believe that's what our next expert speaker, Professor Rick Steiner, is going to talk to us about. And joining us from Alaska, Professor Steiner is a marine conservation biologist in Anchorage, Alaska, was a marine conservation professor with the University of Alaska for a number of years, serving in the Arctic, Prince William Sound, and Anchorage. He has tremendous experience working on oil spills in the Niger Delta for many years. And today he consults globally on marine environmental issues, including offshore oil, climate change, deep sea mining, and citizen oversight of the extractive industry. Professor Steiner, a warm welcome to you. Thank you very much for being part of our initiative. What can you tell us about addressing the needs of people affected by an oil spill?
Well, there are certain, thank you very much for hosting this, and hello to all the fellow panelists. Yeah, I'd like to echo as well my sorrow for the people of Mauritius having to go through this. These oil spills are chaotic, no matter how big they are, and they tend to bring out both the best and the worst of humanity. So be patient with yourselves. And all spills are different, but all have some similarities. Once the oil, in my view, once the oil is spilled, much of the battle has been lost. Industry and government habitually tend to understate the volume spilled and they habitually tend to overstate the effectiveness of their response. Environmental damage can last for decades, such as our spill here in Alaska, the Exxon Valdez. We still have damage today from the spill that occurred 31 years ago. There's many things to deal with for Mauritius here. Offloading the oil from the ship was #1, and I congratulate the people that lightered that and got that done. But now you're in a new phase. There will be less media attention, and so there'll be a different sort of psychological context for everybody to work within. You're about a month into this. You've got spill cleanup, wreck removal, damage assessment, claims, restoration, and then the very important long-term solutions to look at to prevent this from happening again, which is ever important and perhaps one of the most important aspects. The West Indian Ocean shipping routes are pretty heavily trafficked. I believe you need areas to be avoided, vessel tracking, routing agreements, potentially the establishment of what's called a productive sea, potentially, let's say, PSSA within the IMO, International Maritime Organization designation, whereby coastal states can actually establish areas to be avoided in routing agreements. There's no excuse for a cargo, a transit ship like this to be that close to Mauritius. Most of my work is in prevention, damage assessment, and restoration, but on the theme today, I think it's been pretty well covered by LIESEL and RIKI and others, that these things form corrosive communities. There's a lot of anger, anxiety, substance abuse, distrust of government and industry, and this laid on top of concerns, it's unprecedented. We don't know how that works. So this is something new in oil spill issues. But certainly one way to help with this, and what I wanted to just mention real quickly and then be done, and also with other problems and spills, is a formation of a Citizens Advisory Council to represent citizen stakeholders, all those that are potentially impacted by this, and all aspects of the response. And I have recommended this to the government in Mauritius and other NGOs there as well. And there are two potential approaches here. One is to establish a temporary and immediate Wakashio Oil Spill Citizens Advisory Council to represent civil society in all aspects of the response. We did this essentially in Exxon Valdez here in Alaska, where there was a emergency command team with the US government, the state of Alaska, and Exxon, the spiller, and then a few of us representing the local communities, the fishing community, sat on that command team and were part and parcel of every single decision made. And that was a way of generating trust. And also, they didn't know much about the local area. We did, so there was a reciprocal relationship there. So that is one thing that could be done immediately in Mauritius. But then beyond that, beyond the Wakashio spill, you might consider the establishment of a permanent Citizens Advisory Council to advise on all environmental risks in Mauritius. This is something we've been working on around the world for the last 30 years. A good example of that would be the Prince William Sound Regional Citizens Advisory Council. The website is just usrcac.org. They're just advisory. They represent all potentially impacted stakeholders within the oil impact region. They have a steady stream of financing from the oil industry directly, and that's about $4 million US a year. It's been very important in building trust between the citizens, the industry, and state and federal government. And that's a very precious commodity in the aftermath of these things. So the process from here on out in Mauritius, I believe, if you want to explore this, is number one, identify what are the threats to the environment of Mauritius that you want to protect against, number one. Number two, which industries or activities pose these threats. And then three, identify all the civil society stakeholders that would be potentially impacted if one of these threats becomes a reality. And it needs to be designed to the specific situation in Mauritius, and I believe it can. But again, this is the local people's decision, whether you want to proceed with something like this or not. It has to be done organically from the ground up. And one critical thing, two critical things a Citizens Advisory Council need are, one, government endorsement. The government of Mauritius would need to endorse this council as a standing advisory body. And then secondly, a permanent funding stream. And that can come either directly from industry, from government tax revenue from industry, philanthropic support, or other. But that's critical to the maintenance of a structure. I wrote a paper for the United Nations Environment Program a few years ago. Lilani has a copy of that. I have a copy. People can let me know. I'd be glad to send that to you about the general formation and structure and function of citizens councils. And also, I sent a copy of the guide that LIESEL just mentioned, the guide to coping with technological disasters, to Lalini. She has a copy. I have a copy. I'm sure LIESEL has a copy. RIKI probably has a copy. We could send it to anybody, but it's a good guide to sort of what to pay attention to. So I think that's all I need to say. And we'll, since we're long on time here, short on time, I think I'll end there.
We're actually much quite over time, but we'll make it work. Thank you very much, Professor STEINER, for enlightening us on the importance of advisory councils in Mauritius. I think it will help the people on ground a lot to address the psychosocial needs in the context of this spill. Now moving on finally to our last speaker for the evening is Dr. Jérôme Brioude. Dr. Brioude holds a bachelor's degree in physics and a PhD in meteorology. In 2006, he joined the National Oceanic and Atmospheric Administration in the US to work on pollution and cloud cover over the Gulf of Mexico. In 2007, Dr. Brioude became a research scientist focusing specifically on air pollution. And in 2016, he became an assistant professor at the University of Réunion Island to teach in the Department of Physics and to work on marine emissions at the LIESEL laboratory. Unfortunately, Dr. Brioude could not be with us live tonight, so he kindly pre-recorded his expert opinions to share with us tonight in this webinar. And we thank him for his contribution to our platform. And in his video, he will be addressing here concerns of air pollution in the context of this. I will now ask Lalini to just play the video for all of us, please. I think the sound is off. I'll just ask. There we go.
Jérôme, thanks a lot for joining us. And ultimately, I mean, we'd like to have your thoughts and your insights on what your experience, first of all, from the BP oil spill, and what you've been able to do and see and experience. And some of the, again, it's not the same scale, but some of the issues that we may all want to think of when we're talking about the potential air risk and air pollution risk from the Wakashio oil spill. So over to you, thank you.
Thank you, Laini, for having me. So yes, with my colleagues at NOAA, we had the opportunity to sample air masses coming out of the deep water horizon oil spill. So there was an aircraft, scientific aircraft that did transects over the ocean to sample different compounds. And what we found was, so those oil spills emit hydrocarbons. We also call it volatile organic compounds. So because those compounds are on the in the liquid phase and then goes to the atmosphere. And this is typically this kind of compounds that you can get in paint. So when you go to the grocery and search for paint now, you'll see some information of VOCs. If you buy a paint that have very low VOCs, then if you paint your house, it's not going to smell a lot. And so this is the kind of compound that those oil spill emits in the atmosphere. And they have three consequences for air quality and human health. The first one is they release benzene and toluene. So those specific compounds are known to be harmful. If you live in an urban area that have these kind of compounds, you can have more chances to get cancer, for instance. The second effect is the heavy VOCs will tend to generate small droplets called aerosols. And they will generate very small aerosols. And those aerosols, if you breathe them, they can get very deep in your lungs, stay in your lungs, and then can be harmful for your body. So one way to monitor those aerosols, so it's to have monitors that measure PM 2.5, so it's particulate matter. 2.5 means with a size lower than 2.5 micrometers. These are the most harmful. And you can also measure PM10. So PM10 is a size lower than 10 micrometers. And then the third effect is those VOCs can then react in the atmosphere to produce ozone. Ozone is known to be a pollutant, and actually it's also, so it's bad for human beings, it's also bad for crops. If you try to grow something in an environment with high ozone, you will produce less than in a clean environment.
What would be your recommendations for the future? Again, it's not the same scale as other oil spills, but you mentioned that it was closer to the shore. So what would be your final recommendations in terms of the potential risk and how important it is to monitor all these different elements?
And so one thing is to check the wind direction, of course. If you are downwind of the oil spill, then you have more chances to get this kind of gases than someone upwind, sorry. The other thing is to develop the monitors of ozone and PM 2.5 and PM 10. I know that there are some initiatives that try to develop low-cost monitors. For instance, my lab is testing new new sensors for PM1, PM2.5, and PM10, and they cost about 400 euros a piece. While typically you would need to buy a sensor of 30,000 euros to measure this kind of this kind of compounds. So if you can develop a network of instruments at low cost but reliable, then that will help potentially mitigate the impact of this oil spill by quickly provide some guidance to the population on where to stay, where to go.
Well, thank you very much, Jérôme, for your time.
Thank you, Lalini.
Again, that was Dr. Brioude joining us from Réunion Island. Apologies to everyone. I think we've run, far ahead of quite late into the session. It's almost 30 minutes past. I will just want to quickly wrap up this session and just address one question that we've had that came up during one of our in the chat box. And the question, I think, will go to Dr. HERON, Dr. Richard HERON. There's a question from Vikash Tataya from Mauritius asking specifically about the health risk denialism. He's saying that a lot of the advisors here in Mauritius are saying that one should not fear the health effects of petroleum, and that petroleum floats on water, and that they don't collect, or sink down into water columns. So he's asking, what is the basis for that health risk denialism, essentially? Can you have some words on that, please? Sorry, I believe we just need to unmute you quickly. I think Lalini will just do that quickly.
Yeah, sorry. We could spend another half an hour on this at least, I would say. But I think actually, RIKI, Dr. Ott summarized this really quite well. It's about dose and vulnerability, first of all. So, all substances are potentially harmful in the wrong dose in a vulnerable person. So I think one should never forget that point, no matter what the circumstances. Then I think it's really the point I was making earlier is it is actually very similar to the COVID situation. So many views, so many opinions coming from all directions. It's very difficult to make sense of what is the right answer on things. And I think that's where this shared decision making and deeply thoughtful and critical review of science is really important, but done with where you can, with the most independent and most respected relevant scientists for your country involved, and again with the community deeply involved at the same time, to have this iterative conversation about what do we see, what do we feel, what does it mean, and is that rather again like COVID, even though we know a lot from previous oil spills, they all have similarities and where it was and what the conditions.
Sorry, I believe we've lost Dr. HERON there. Yes, all right. So I think we've reached the end of our session. Thank you so much for everyone for their input. I think we've had a very rich exchange so far, and I will now pass back to Adish for the closing remarks. Thank you everyone for joining us. Back to you, Adish.
Thank you very much. Thank you, everyone. I think extremely interesting. And if I may, look at the narrative that we've had from the start with the point of view from the industry itself, from the energy and oil industry, going down to the effects from a more medical point of view and health issue, and discussing the effects that those oil spills have on the psychosociological aspect of people and their community. I think the narrative was very interesting to evolve as we were listening. Dr. Jérôme Briod as well, from the technological point of view and the atmospheric point of view, was very interesting. I think sums up quite a lot of our discussion. We were very impressed and very thankful for all that you discussed today. Let me just give the floor to Dr. Smita Agura from the University. Please, if you may just close the session now. Thank you.
Yes. First of all, I'd like to thank everybody for sharing their experiences. I'd like to thank the audience for being so patient and for listening so attentively. And I would like to thank the moderator for being such an excellent moderator. And thank you very much, Adish, for organizing such an excellent session. I think the main take-home message for me was today was to really involve the community in all decision-making processes. I've learned a lot from all the experts, and what I have really, the message that to me is very important is that the trauma that's been caused to the communities, and that the communities should really participate in all decision-making processes. And really, we should be supporting the community for a very long time. So I hope that we will be able to rise to the challenge. And I look forward to the contribution of all experts in helping us to develop research themes and to help us in our research endeavors so that we may help the communities and also the country at large. So thank you very much to everyone. Thank you.
Thank you. Thank you very much. And I hope to see you next time for our next webinar, which will be on maritime security and surveillance. So until next time, thank you very much and goodbye.